want to look good. And I'm sure you do too. But the thing is, I want to look good and feel good about looking good. I don't want to invest my time into looking after myself if it's going to leave me feeling financially stressed, anxious, and overwhelmed. But for some reason, when it comes to skincare, I find it very difficult to do anything for my skin without feeling like any of these three things. If I had to visually put it out for you, I feel like I'm standing in the middle of Times Square in New York, and all these advertisements are just posing the million-plus questions on skincare. What type of skin do I have? Do I use soap? What is peptide? Do I get a vampire facial? Do I use a product that's naturally occurring or something that's been made in a laboratory? Whose nighttime skincare routine should I follow, Hailey Bieber or Alia Bhatt? If dark chocolate is bad for my skin but good for stress, shouldn't I be eating it because doesn't stress make your skin age faster? Should I spend 20,000 rupees on hand-washed cow ghee cream and a Dior face cleanser? Or should I try a free TikTok skin hack and buy a new mattress because don't you need good sleep to get good skin? Skincare is madness. Agree with me because I know you do. This is Sonalia Charji, and you are listening to Health Wealth, a podcast that wants to help increase your knowledge about health, but not take away from you the enthusiasm and joy of looking after yourself. I don't think there is any organ that's quite so profound as skin. It can bring us pain, it can bring us pleasure. It has started wars. It brings people together at a young bride's haldi ceremony. It keeps our bodies cool, but it's also a great surface for bacteria and germs to survive on. Skin tells us upfront the story of someone's life, from the wrinkles or the scars or the tattoos or the makeup. And the way skin will stretch and contract over someone's face is how we first get to know what someone is feeling. With all this, it's no wonder that we care deeply about our skin. And where there's interest, there is industry. And skincare is worth billions today. What I find very, very interesting is how the best brands manage to capitalize on all these emotions around skin. So when you hear someone say, put this wonderful scented cream made out of Persian rose petals and Sicilian almonds, you want to do it immediately. And it's great, but sometimes it does go overboard as well, because today anything and everything is being used for skincare. Charcoal, wine, chocolate, coffee, walnut, oatmeal. Sometimes I don't know if I'm going to a pharmacy or a restaurant. But with all this, the real question to ask is our skin getting any healthier? Because we do have a lot working against us as well. The pollution, the stress, the junk food, the lack of sleep, diabetes, obesity. Is Persian rose and Sicilian almond enough to negate the impact of all this? Acne is prevalent in nearly 73% of adolescents, according to a 2020 study, which was published in the Indian Journal of Clinical and Experimental Dermatology. Another study in 2017, which looked at the burden of skin diseases in India over the last 3 decades, found that there was an increase in acne of almost 153%, and that overall the burden of both infectious and non-infectious skin diseases had gone up in India. So on one hand, we have our pantry being turned into facials and creams and cleansers, but on the other hand, skin issues are going up. To help us make sense of this dichotomy, I have with us today Dr. Rajat Khandari, who is a dermatologist. He has his own clinic in Delhi, and he also heads the Aesthetic Special Interest Group for the Indian Dermatology Association. Dr. Kandari is also the former Vice President and Honorary Secretary for the Indian Association of Dermatology's Delhi chapter. Hello.
Hi.
Thank you so much for coming
Hi,
all the way
Sonali.
here.
Thank you for having me. My pleasure.
Now, you come from a family of dermatologists
I do.
with your father and grandfather both in the same profession. And I want to ask you something a little personal up front. What is your skincare routine?
Well, till not long ago, honestly, I didn't have one proper skincare routine until maybe a few years back when I started feeling I must practice what I preach. And also my skin started telling me I should.
Right.
So basic stuff, I think, a good sunscreen in the morning, surely. I try to keep my skin hydrated. Retinol on alternate nights. I try to do at least this much, if not a few more steps here and there. And maybe, get a small little procedural laser done once in 2-3 months or something of that sort.
Yeah. And growing up also, did you have any sort of regimen, considering you're surrounded by dermatologists?
Honestly, while I was growing up, there was not a lot of all this, right? We've come a long way. I think now skincare has become elective. A person doesn't go to a dermatologist so much for a disease. Our practices have changed. People come in for disease is one segment, but people come in to look good, feel good, as you said. Way, way more than earlier. I don't remember people having a skincare regimen maybe 10, 20 years back. Our mums used to use a moisturizer and there was no sunscreen even, if I remember. So I think lots has changed, but a lot has changed for the good. But like you beautifully put in that monologue at the start, I think so much has changed that sometimes it's just too confusing. And maybe some is for the good and some isn't.
Yeah. So just to make sense of the confusion, I thought we'd start at the very, very basics. What is skin?
So you said something that our skin tells a story, right? So skin is the mirror of the soul. And in basic scientific terms, skin is the largest organ of our body. And it has 2-3 aspects to it. One is the upper part, which we call the epidermis, and then is the lower part, which we call the dermis. There's a lot of talk about collagen, elastin, skin glow and loose, so on and so forth. So that's where the dermis comes into play. And the epidermis is made up of skin cells which shed and have a turnover throughout the day. At the base of the epidermis, there's a cell called the melanocyte, which is the pigment producing factory. And then there are immune cells. So like your body's immunity, your skin also has an immune system. So for example, if something's trying to enter through your skin, let's say it's a virus, your skin will try and respond to that insult or to an allergen. And that's when you sometimes get, a rash when you go somewhere close to a construction site, let's say. So on and so forth. So in basic terms, that's what it is. And well, it's made up a lot of water. And then there are oil glands, sebaceous glands, and your hair gland. So these are the common things in the skin, if I have to put it in a very, very nutshell sort of way.
And how do we know what type of skin we have? Because a lot of this routine or regimen is based around what's your skin type. And I've always found that very confusing. And also, does the skin type does it change with age or does it stay constant?
No. So coming to the first part of the question, how do we decipher our skin type? I think the best time to do that is when you wake up in the morning or maybe 30 to 40 minutes after washing your face. So in very, very basic terms, if you feel oily after, or if you have a shiny look after washing your face 30 minutes, 40 minutes later, you probably have oily skin. If you notice a shine just on the nose but everything around is normal, you have a combination skin. If you feel dry and tight even after washing with a gentle cleanser, then clearly you have sensitive to dry skin. Else, if you're comfortable, then probably you have relatively normal skin. By normal, I don't mean that oily skin is not normal or is abnormal. It's just that that's the sort of nature of your skin. And yes, your skin not only changes with age, but in some of us, even conditions, environmental conditions, can have an effect on your skin. So if I'm in a tropical climate, say in Goa, my skin might behave differently versus if I'm in Kashmir, it might behave differently.
And there's so many things that you read about that impact skin. And I had a couple which keep on coming up on internet searches. So the number one is, how does your hormonal health impact your skin, especially for women now?
I think that's 1 in 3 women now have PCOS. That's polycystic ovarian syndrome now we call it, rather than disease. And there's a reason for that it encompasses a lot of your systems. And that does have a clear impact on our skin. And the common things associated with a hormonal undercurrent are what we call hyperandrogenic features. That means more androgen, which a man has more androgen. Androgen is testosterone.
Okay.
And a woman has lesser androgen. But in certain such conditions, this whole balance gets deranged. So your androgen goes up. So if a woman has more androgen, you can expect acne, because that triggers the oil gland to produce acne. You can expect a little hair around the chin at times, or the chest, or the belly button area. And you can expect also a hair loss or a hair thinning. Having said that, I don't want to give the message that every hair thinning is associated with hormones.
Yeah, yeah.
But yes, these are common things.
Yeah.
And, it may be associated with overweight, disturbed menstrual cycles. And the kind of acne that we see is different than the usual kind.
Yeah.
It has the particular picture. You might be having a premenstrual flare, so on and so forth. Along with this, yes, with thyroid, there are numerous disorders which have a clear-cut, validated association.
Yeah.
For example, you've seen people with blemishes on the face. That has a clear-cut association with thyroid. We know that. And lastly, if you're taking some pills, such as an oral contraceptive, for example, it can trigger blemishes or melasma,
Right.
or enhance pigmentation. So these are some common things, and which is why nowadays so much is said about a holistic approach to keep your nutrition, your sleep, etc. in order, exercise, so on and so forth, so that your hormonal balance stays in check, and hence your skin appears better as well.
And there's a new sort of buzzword coming up now, and everything is related to the gut. Is skin also, is good skin related to how well your gut is being maintained?
I think what you eat shows on your skin and your hair, sure. I mean, let me put it in a very simple example. If you've gone for a night out, having junk food, drinking whole night, next day you see it on your skin, literally.
Yes.
But on the contrary, if you're exercising well, you're eating well, balanced food. I'm not saying go all out and have every day hordes of chia seeds, but
or
even
blueberries.
Or blueberries, but a normal balanced diet.
Yeah.
And I think if your gut is in check, your skin definitely, it definitely reflects on your skin. Having said that, yes, there are lots of disorders which have now a lot of data on the gut-skin axis, which is directly correlated. For example, psoriasis. For example, acne. These have a clear-cut validation that, yes, there is some association. So sure, I mean, I think lots is being worked on in this zone, but it does have a role.
Yeah. Now, I really want to come back to the topic of acne eventually, but before that, the two things that we use on our skin, every one of us does, soap and scrubs. Can you shed some light on what kind of soap should we be using? Because some people will say that if you use too much soap, you're ridding your skin of oil and there's chemicals. And some people say if the soap doesn't lather, then you're basically not getting rid of the germs. And then the scrub thing also comes in. Are you scrubbing too much of your skin away? And now we're using extremely hard products as scrubs as well.
Yeah, so coming to the first part, let's start with what the soap is actually. So your skin has an acidic mantle, right? Your skin has an acidic pH. Soaps are alkaline.
Right.
So if I keep putting an alkaline soap on an acidic medium, as you said, some people say it strips the skin of its natural oils. So the barrier of the skin, which is made up essentially of oils and cholesterol, gets stripped off.
Oh.
So in COVID times, if you remember, excessive hand washing and you've got hand eczemas, that's only because you're using too much sanitizer or soap repeatedly. So there are kinds of soap, some which go through the full alkalization process, some which are known as safer soaps or what we call synthetic detergents, syndettes. These are typically what we use for kids. What they have is a long chain of fatty acids, but they will not penetrate your skin too much. So they clean reasonably, but they won't have that wow factor of that lather, wonderful smell, this, that. So they are safer to use for someone, let's say, who has very dry skin or sensitive skin. Of course, you should use soap, but be mindful of how many times you're using it. If you're using it, 15 to 20 times a day, that is obviously not right. And in fact, that is on the borderline of an OCD, literally, which is common nowadays. But yes, if your normal soap is being used, try and prefer something mild, gentle, moisturizing, closer to a normal skin pH or a neutral pH, let me put it this way. As for a scrub, the same thing. You're mechanically exfoliating your skin. And as you said, nowadays, many of us are already using some stuff, like let's say a retinol, let's say a vitamin C or a glycolic acid. So already that's drying your skin out a bit. So if you're going to use your scrub more often than not, you can go wrong. Right. Sure. If you have oily skin, scrub is fine. Maybe once a week or twice a week. That's what I recommend, not more than that. If you have dry skin, I would steer off the scrub altogether.
Yeah. And would you recommend stuff from the kitchen, like papayas and whatnot, naturally occurring products or things that are synthetically made?
I always find this as a trick question because everyone loves home remedies, right?
Yeah,
but, I can't say they are wrong. What I would say is that if you have sensitive, dry skin, etc., please be careful about what you're using because none of this has standardization. So if you're using other stuff or actives on your face, I would say first see your doctor. And if he or she is okay with you using it, use it. So, I mean, it's being used from time immemorial, right? I mean, curd is form of lactic acid. So it's being used, milk. But use it with caution, sure.
Is there, I mean, in your career so far, have you seen harm being done due to people self-medicating on skin?
Every day now.
Okay.
Unfortunately.
How bad is it?
I hate to say this, but because of the advent or the explosion of Instagram and social media, it has become extremely common. We see sensitive skin way more than we used to. And it's because of overuse of actives. So we need to just breathe and calm down on some time.
It all sounds so appealing, no? You don't really think about what you're using. It just sounds glorious in some ways.
Yeah, but I think one needs to balance it out. And one regimen doesn't work for everyone. Right? If I see your skin versus my skin, it's different. I can tell it from here, and I'm sure you can tell it. Yeah. So clearly, you and me might not go with the same regimen. So one has to use it with caution and be sure of what one is using.
Right.
And take it step by step. See, you're not going to achieve miracles overnight either way. So let your skin tolerate things and then move on to the next step.
And another thing, out of those made in labs now, there are endless number of supplements coming out. So, I don't know, collagen, vitamin E, vitamin C, I can't even pronounce some of them, retinol, salicylic acid?
Yeah, so these are, some of these are topical agents.
Yeah.
But the collagen...
But are there any that you would recommend?
No,
for
so
normal
sure.
Skin.
See, retinol, vitamin C, they all have fair amount of data supporting their use and good data. So yes, I do recommend them and there's nothing wrong with using them as long as you're using it in the right manner and the right agents, the right concentration and build it up.
Right.
As for stuff like collagen, yes, it's another buzzword nowadays that my friend's taking collagen supplement, should I take it?
Yeah.
collagen is a big, long molecule. So what we get are hydrolysate or peptide form. So it's broken down.
Oh, it's the same thing, peptide and collagen.
One of the
Okay.
collagen peptide, we call
Right.
it. So why it's broken down is so that it can actually be absorbed, because the absorption is questionable. So while there's not enough study to tell us that when I take this collagen, let's say I take 5 grams, which is the usual standard dose of 1 scoop of many of these supplements, will it go to my gut, get absorbed, find its way to my skin and do the magic?
Yeah.
We don't really know.
Yeah.
But yes, it has helped. There is data saying that it improves collagen in the skin. It decreases signs of aging, sure, and it enhances hydration as well.
Yeah.
So there's no harm in taking it. Again, not overdoing it. If you're taking it, it's more like a protein supplement. It's made up of amino acids. So you'll find many protein powders, in fact,
Yeah.
supplemented with
Yeah,
collagen
yeah.
at times. So you can take it, just be a little mindful, particularly if you have kidney issues.
Yeah.
One could go a little slow on it, because sometimes it can cause
Yeah.
enhanced kidney stone issues, so on and so forth.
And should you preferably maybe go to a doctor first before you take supplements?
I would always recommend that for any vitamin supplement, etc., etc. See your physician. It's always better. I mean, it takes a little bit of your time, but maybe you're a bit more sure about what you're putting into your system.
Yeah.
As is, we are putting so much into our system. The whole phenotype of diseases have changed today as compared to what they were earlier. We are finding baldness in 9 years olds. So why is all this happening? It's obviously something to do with our environment and what we are eating, how our lifestyles are. So no harm in taking that consult and being sure.
Yeah. And out of all the skin issues that exist, acne is the most common. So I thought we should talk a little bit about that particular condition. What is it? Because, the old wives' tale is acne is just some germ on your skin or inflammation. Then you go online and you'll have these detailed, various diagrams and so on. But really, what is it? And do different people have different kinds of acne?
Yeah, there are different kinds of acne, yes, but the old wives' tale is not completely wrong. There is an organism. It's called P. acnes, and you used another word. I'm missing it now. Inflammation.
Inflammation.
Yes. So there is an organism. It stays in your oil gland. Now, if sebaceous gland. Now, when it gets ideal conditions to thrive, let's say you put a lot of makeup one night, and many times in the morning one gets up with a zit. Why is that? Because you've occluded that gland. It's building oil. That bacteria is there. It's going to have a party when the oil increases. And the party comes in the form of inflammation.
Right.
Which forms the pimple. So if it gets the right conditions, it will thrive. Now, yes, someone may have very high oil gland activity. And someone may not get that pimple even after the makeup. So it depends on our oil gland activity, which we call sebum excretion rate. So someone's got it high, has more tendency to develop acne. Lastly, if a teenager gets acne, I think you'll also remember, Sonali, that they used to tell us T-zone, right?
Yeah, yeah.
We always get it in the T-zone.
Yeah.
But as one ages, one sees that our acne starts going down here. That's called adult acne. More common, as I said a little while back, hormonal undercurrents are more common with that kind of acne. So yeah, there are different kinds of acne. And then there are times when you're cooking the whole day, let's say, you're in a hot condition and you get something on the face. We call that cooking acne, or McDonald's acne was a term, by the way.
Right.
So these are different kinds of acne. And lastly, there are some drugs which can also trigger acne, particularly some anti-cancer drugs, anti-tubercular drugs. They can trigger acne. Even something as simple as a B12, B6 supplement, just for your viewers, can trigger acne.
Right.
So some of us, when we are taking it, B6, B12, whey protein, chest and back acne is common with these. So one should know that.
And what about treatment for acne then? Because, our understanding and the rate of acne has gone up. Has treatment improved at par?
I think treatment for acne has always been there, more or less. And yes, there are some, advents in that field. But I think what's become more prevalent is how aware the younger generation is now, and how This started coming early to a doctor. Earlier, moms used to say that it's okay, it's acne, it'll go off.
Yeah.
But it's better to treat the acne because of that inflammation that we mentioned, because else you're going to be ending up with scars which you might regret for the rest of your life. So it's better if you treat it early, hit it hard, hit it early, is a better mantra rather than keep watching it and do it later.
Yeah.
Also, on this question, on this note, I'd definitely like to say there are lots of mums and lots of patients who come in and they say, why are you giving an oral drug? Are you sure my son, my daughter requires it? A doctor would always like to give a drug if the condition demands it. That is my usual thinking, I'm hoping. And why the oral drug is being given is for this reason, so that this scarring can be prevented, because it is preventable. So I always give them this example that someone has mild asthma and severe asthma. If someone has severe asthma and they can't breathe, then obviously they're going to take an oral pill, right? So if you're getting scarring or you're prone to it, it's better to take things early and you can wean it off. But yes, there is treatment and acne can more or less be cured.
Yeah. No, I find it very interesting that you're talking about this early treatment or early diagnosis for acne, because when I was young, I would have used mud from, I don't know, Dead Sea to some volcanic Pacific island, all sorts of things on my skin, ice. But I never thought of going to a doctor. And I think it was my 20s that, one of my friends was a doctor and he said, go to a dermatologist. And I said, what is that? Why is it important for us to actually go to you when everything is also there now online on the internet? So what have you learned that our internet search cannot tell us?
I think more streamlined information. An internet search is sometimes a little difficult to navigate. And also, 4 years of MD. No, on a serious note, see, the internet tells you a lot of cosmeceuticals. And then there are prescription drugs. When you're coming to a dermatologist, you're getting a mix and match of both. And there was a time when there was no cosmeceutical in our prescriptions, which is what I was saying. Lots has changed. Today, let's say you come in and you tell me I want to treat my acne. I'll say, okay, just so you're happy, we'll use that niacinamide serum that you love in the morning. And I'll give you a tretinoin in the evening, which you cannot get over the counter. You'll have to go to a chemist with a prescription. So you need to have a mix and match of those for the best and most optimal outcome. Otherwise, you're just going to delay things. I mean, of course, if you have 2 pimples which are one-off, you can maybe manage it at home with a salicylic acid.
Or toothpaste. Does that work?
No, please no toothpaste. And
that doesn't
can burn
work.
your skin, so please avoid it. And I've covered this so many times that don't do that.
I feel like, sometimes one should sit a dermatologist down and just do a rapid fire round. Like, does basin work? Does papaya work? I mean, it's endless.
Yeah, so don't do the toothpaste though. But so that's the basic difference. And of course, I think every disease, today you have so much online. I can manage so many things. And being, unfortunately, in a country like India, still we have a lot of grey market. We can go pick up a drug anywhere. It's getting better, but I think long way to go. So one has to be a little careful about these things and go in a guided and the right direction is what I would say.
And it's also so manipulative, with AI these days. If you're following some influencer, you're not even very sure if that skin results are the real skin or, something that's been manipulated. So it does seem, some of them seem quite fantastical to do.
Correct. I agree.
And,
that is a big problem, honestly.
And then once you mess it up, then you have no choice but to go to a dermatologist.
And that's what happens. That's what I was saying. That's what's happening nowadays.
Case.
It's so much. And I think the pressure which the younger lot are going through nowadays is so immense. I'm sometimes amazed at how conscious we as a as we've become.
Yeah.
And particularly the younger generation, I think they're so much more exposed to this than maybe we were, and then our parents, which weren't at all.
Yeah. Yeah.
So it's become a situation, honestly, which needs to be handled with care.
Yeah. No, skin is.
I think, sorry to break you, I
yeah.
think what you put on, please do it responsibly, because it is important that the right message goes out. What works for one person doesn't work for the other. And you can't say that use a drug such as isotretinoin or a tretinoin on social media, because it's just not right,
Yeah.
in my opinion.
So, very often you can ask a doctor or dermatologist, give 5 tips. And but skin is deeply subjective from person to person. But for a healthy person with, say, normal skin, healthy young adult, are there 5 or as many as you'd like lifestyle sort of choices you would say to take up that can sort of ensure health of the skin in the long run?
Yeah, I think some of them which we covered, one of the basic things would be nutrition, sleep, hydration, right? So all of them have a role, and these are validated roles. So diet may be rich in antioxidants and a balanced diet, good sleep.
Okay, I will interrupt you. This rich in antioxidants.
Rich in antioxidants, yeah.
Okay, how rich should I go?
That's what. So there's no clear answer
That's
to that.
the thing,
Which is what when you ask me about home remedies, that's why I said these are trick questions, because there is no standardization of this.
Yeah.
So while one can put in those blueberries in our smoothie, but that's why I'm repeatedly saying a balanced diet is better.
Yeah.
So you have your vegetables, your protein, and keep it like that. That's better, rather than running after a lot of fads which keep happening, and they keep changing every few weeks, right? And sleep, why I said sleep, because it's important in recovery, restoration, and balancing hormonal profile. So from that perspective, that's important. Hydration, we all know that's important. A well-hydrated system will lead to a better hydrated skin and an overall better looking skin, or a supple skin. And coming to the third thing, I would say basic moisturization as per your skin type, and a sunscreen. At least one can use these. And be mindful that, okay, when I'm going out, I should wear my sunscreen.
Yeah.
Mind you, the screen that we are looking at the whole day, that also has visible light and infrared. So you're aging with that as well.
Does blue light aid skin?
Yes, it's a known fact now. So that's why you'll find sunscreens with blue light protection, and which is why we say that wear sunscreen indoors.
How
as well
does it
as
age your
possible.
skin, though?
So blue light leads to what we call reactive oxygen species stimulation in the skin. And I put it like an example like this. So when you see the PM levels, the 2.5 that we talk about. So they're like small chemicals, cigarettes burning or smoldering into your skin, literally. That's what even something like this overuse of the screen time, it's stimulating these radical oxygen species or reactive oxygen species. And that leads to a lot of inflammatory mediators getting activated in the skin. So our body is so complex, right? And that leads to these aging changes, a cascade of the aging change.
Yeah.
So on and so forth, a cascade of pigmentary abnormalities. So we as Indians age with pigmentation, and blue light's known to trigger pigmentation. So these things. So one
That's
can use at
fascinating.
least their
Yeah.
sunscreen and get into that habit earlier than later again, because we are seeing way more carcinomas also now than we ever used to earlier.
But that's interesting because as Indians, they say because of our
Yes.
pigmentation, we don't get skin cancers.
Yes, we don't. We are relatively well protected because of our melanin. But I'm not saying just skin cancer, but other cancers as well. So yes, but skin cancer is also on the rise than it ever used to be.
Yeah.
So it's better, it's a good choice to maybe at least do those things.
Yeah. You know, it's really interesting, but I think the relationship between a doctor and a patient, it's something that's so vastly overlooked. perhaps, there's been no relationship that I can think of, not even with my spouse, that actually demands so much of understanding between two people. And the most complex procedure I've ever done was actually done by you. And I'm often asked this because I was breaking down my scar tissue and you were drilling needles an inch into my skin and there was blood. And everybody asked me, how did you do it? You must have a very high pain threshold. And I don't. I will weep over a paper cut. But I did have a high degree of faith in your skills. And that was very important for me as a patient, that I can trust a doctor. With all your years of experience, and if there's a young dermatologist starting off today, what advice would you give him or her on how to treat patients and how to build that sort of doctor-patient relationship?
First of all, Sonali, I'd like to thank you for bringing this up, actually, because I think with so much change, this is also the prevalence of this relationship is now seeing a gray line somewhere. I remember that, I'd go to that doctor wherein I have faith and trust is no matter where that doctor is.
Yeah.
And I think building that trust is so important for exactly a doctor-patient relationship. As for a young doctor, I always say two things. Everyone's time comes. So please be patient, ethical, and responsible in what you write on that prescription. And very rightly said that form a good rapport with your patient. See, on a patient, you don't want your patient to come on that day, do a procedure, make a buck, and send them away. This is your patient. This is your responsibility. And you want it to be a relation, right? You want this patient to come back to you, have a good relationship, tell her friend that he was a good doctor. And that's what you did medicine for, didn't you? So that's what I always tell them. It might be a little old school, but I feel that somewhere it still has its place.
Yeah.
So I think that's for me, that's the right way to go.
Yeah. No, as a patient, we can also do so much. So I remember I researched on you. Like I Googled the living hell out of you. So I went through.
I don't know how much there is, but still.
No, but there's stuff on the fact that you publish, the fact that you teach, the fact that you're part of associations. Those all build that sense of trust, no? Technically, you are a stranger. I mean, you can list all your qualifications, but what are you doing with them? If you're open to technology, that tells me that you're, sort of up to date with the latest advancements. You're not, resistant to change or innovation. So
it's strange that you bring this up because nowadays, earlier, maybe 6-7 years back, 8 years back, a person who used to pass out of MD, let's say, used to ask, how much money should I segregate to build my clinic? Now they ask, how much money should I segregate to build my clinic and to promote myself socially?
Gosh.
So it is a thing which has become so important that you Googled and you found out. So that means it lent some credibility, right? So I guess that it is important somewhere.
Yeah. And as it's sort of growing, patients are becoming aware that you do need to get to doctors.
Sure.
I always think that that's the answer to all these problems, whether it's skin or heart or diabetes. It's actually finding the right doctor and going through with it.
Yeah, true.
Yeah.
And now there are so many portals which have, I call it the Zomato of doctors, unfortunately. But because you can't find a doctor like that.
No, you can't.
I won't tell
Yeah.
If someone's mom has a heart disease, I won't tell them that see who's online figuring on the top, go to him. I'll tell them who I have faith in and go to that person, right?
Yeah.
So it's a little different, but I think for some things elective it can work, but for some things more serious maybe it doesn't.
Yeah.
But to each one his own. I think you need to find the right path.
Yeah. And get your access to reliable knowledge.
Yeah, true.
Thank you so much for sharing your reliable knowledge with us today.
My pleasure.
It was so lovely to have you.
Thank you so much.
Thank you. I used to be very conscious about my skin and acne. And like I said, I've done everything for it: ice, mud packs, facials. I have tried yoga for skin, facial exercises, everything. And all it did was financially bankrupt me and cause me a lot of stress. So at one point, I started asking myself, how do I balance this? How do I balance inner and outer beauty? Because I want a bit of both. And that's when I started to think that if everything I am and everything I do is negated by the presence of just one pimple on my skin, there's something wrong with that philosophy. So the balance I found is that do what you can, but don't hate yourself or kill yourself or force yourself if you can't do everything and if there might be a bit of imperfections in what you're doing. It helps that I keep a little playlist on my phone of music that reminds me of self-worth and inner beauty. What do you do to remind yourself of your own self-worth? And what has your skincare journey been like? And more importantly, would you use cream made out of snail mucus on your face? Do let us know your thoughts. We are available on pods@indiatoday.com, or you can message us on 8588966996. And if you enjoyed this episode and if it increased your knowledge base as well as your excitement to look after your skin, then please do leave us a rating. We are there on Apple, Spotify, YouTube, and Google.